One of the underpinnings of Aboriginal cultural safety is compassion.
I trained as a family physician, and I'm currently the chair of the Health Authority Medical Advisory Committee. As well, I'm the executive medical director for physician engagement. I'm also a father and the parent of 3 children with special needs.
Now, Harsh, can you tell us about your own journey to Aboriginal cultural safety?
To me, Aboriginal cultural safety is understanding that it is relational, that individuals are part of communities, and as you know, they interact, they have values, and that history has a profound effect on the way people interact within systems and with other people. We all have histories. My mentor had 2 things he told me before we met her. One is listen, and 2 was to be kind. I'm there with a history and context that really the onus is on us to try and understand or appreciate. We'll never know other people's pain, right? But at least we can appreciate the challenges and not judge people simply on behavior and simply by the stereotypes that we all carry in our heads, but see them as people. So I think it's a continual journey, right? And I'm learning all the time. I'm always floored. When I look at history, I think for physician practice, there are different levels we can look at this. If we start at the very bottom, the day-to-day practice of physicians, I think the first thing to learn is to actively listen, to approach this with a degree of humility that we don't know the answers, and to engage with individuals and know that when we engage with someone, we may need the whole family in the room to understand the story. So part of this is, how do we configure the care that actually is respectful, right? That actually takes into account the community, that takes into account the family and the lived experiences of people. I think what I would ask my fellow physicians is to take time to get to know people, right? Aboriginal people. Visit the bands, visit the nations if you can. Create and lead in creating those safe spaces, because your behavior affects the whole team. And when you demonstrate that ability to slow down, that ability to give people time, to make people safe, you're actually empowering others around you to do so. On the obverse is that when you hear comments that are hurtful, that are stereotypical, it becomes an opportunity to teach.